Hello, this is Dr. Matthew Kincade, one of the physicians at Arkansas Urology, based out of Northwest Arkansas. Here today to talk about kidney stone prevention. Certainly, kidney stones are one of the most common things we see as urologists, but there are ways to try to prevent them. First, I'll talk about symptoms. Symptoms of a kidney stone would be nausea and vomiting. It would be either flank pain or abdominal pain that is just not going away, especially doesn't matter which way you move, which way you sit. It's colicky for a reason. It just does not go away. It can be associated with some blood in the urine. It can also, in some cases, if it's associated with an infection, you can have some fever or chills with it as well. But certainly, flank and abdominal pain with nausea and vomiting are kind of the hallmarks for a kidney stone, especially if it's trying to pass. Certainly, if you're dealing with those symptoms, and especially if you've had a history of kidney stones, you know what they feel like, and so that would be the time to seek care by your urologist. And so, if you just want to try to prevent stones, here are a few options, a few guidelines. The first thing is drink lots of fluids. Staying well hydrated is the best way to prevent a kidney stone. If your urine is clear or light yellow, you've got a lot less chance of forming a kidney stone than if you have dark yellow urine. So the more clear your urine is, the body is showing you that you're well hydrated, and so you have less of a risk of a kidney stone. The second thing is to try to avoid a lot of protein and salt. Certainly not asking anybody to be a vegetarian. I couldn't do that myself. But try to avoid large quantities of protein and also large amounts of salt. Both of those things have been shown in studies to increase your risk of having kidney stones. Now, you don't necessarily have to avoid dairy products, even though a lot of stones are calcium oxalate. Avoiding calcium actually doesn't help much. So go ahead and continue a normal amount of milk, ice cream, dairy products in your diet. But the other thing is oxalate. Oxalate is the other component of kidney stones. And so oxalate is in our diets in large amounts in leafy green vegetables such as spinach, greens, kale, that sort of thing. That's one of the highest chances of increasing oxalate in your diet and getting kidney stones. So if you eat a lot of green leafy vegetables and you're prone to kidney stones, you don't want to do that. Also, dark sodas, dark beer, tea, any kind of dark drink like that also has lots of oxalate and can increase your risk of kidney stones. And the thing that you can do also to protect yourself is citrus. So lemonade, even the Crystal Light brand, or that kind of unsweetened or artificially sweetened lemonade works really well. Even a squeeze of lemon or lime into your water, or orange juice or grapefruit juice. Anything with citrus actually decreases your risk of stones. So we talked about the symptoms: flank pain, abdominal pain, and that'd be a sign to go seek evaluation. And to prevent them, drink lots and lots of fluids, especially citrus. Decrease your intake of oxalate-containing foods, and also cut down on your protein and your salt. If you do start to have kidney stones and you need to be seen, go to arkansasurology.com. You can schedule an online appointment if it's not urgent, but if it is urgent, then make sure to seek emergency care at an emergency room or at an urgent care closest to you. Again, this is Dr. Matthew Kincade with Arkansas Urology in Northwest Arkansas. Thank you for your time, and stay hydrated.